Hi, Diana Alexander here with another San Bernardino County COVID-19 news update. Today I'm happy to bring to you a special mental health tip from our own Dr. Veronica Kelly. She is the Director of the Department of Behavioral Health for the County of San Bernardino. Dr. Kelly?
Thanks, Diana. I'm not wearing a mask because I'm here in this room by myself. So today I wanted to give you some information about how to handle stress and anxiety related to our elders during COVID-19. Important to know that many of us have an increased level of stress because we all have heard over and over again that people who have chronic medical conditions might be at risk for a more severe bout of the disease if they catch it. So here are some things that you can do to reduce anxiety. Number one, know the difference between fact and feeling. My mom wants to leave her house. She wants to come and see all of us kids as well as her grandchildren. So when I'm talking to her, I am separating fact from feeling. Fact, Mom, you can't travel outside of your home because we're trying to stop the spread of the virus. We don't want you to get sick, and we don't want you to make your grandbaby sick. Feeling, and that's why you are feeling agitated, lonely, or afraid. And we talk about it. Separate fact from feeling. Reduce screen time. And for our elder population, we're really talking about media exposure. Having constant bombardment of negativity is not good for anyone's brain, in particular our elders. So instead of having them watch the news 24 hours a day, 7 days a week, suggest that they watch the news in the morning, they do other activities during the day, and then they watch again around dinner time, avoiding the news right before bed because it can negatively impact sleep. A good thing we can all do is create a care package for our elders, our parents and our grandparents. So consider the items that they might be running low on. Canned goods, dry goods like rice and beans, essentials like toilet paper, over-the-counter medications, disinfectant wipes. Package them and deliver them to their front door, and then call from the car and tell them they're on their doorstep so they get them. If your parents or grandparents aren't local, you can do the very same thing with delivery. Just make sure that you let them know it's coming. Along the same lines, find out if your parents or grandparents have pharmacies that they're working with locally. Do they have medication that needs to be picked up? Are they on top of their refills for their medication? Do they have a 30-day supply? And offer to pick up the meds for them. That can be helpful. Also, you can have them make a list of important numbers. Their doctor, the doctor's name, address, and phone number. Any of their friends' phone numbers, any emergency contacts that they also want to include, as well as the phone number or website for local restaurants or food delivery services, and very important, their insurance, their physical health care insurance information. It is really difficult in stressful times to look through our phones to find everyone's phone numbers or to go on the internet. So having them in one spot is very helpful and can reduce anxiety. Video chat. You can call your parents or grandparents every day and talk on the phone, but having one day a week where you can video chat with them, maybe with all of your children, folks in your family, your immediate family, is also helpful. It gives them something to look forward to. And then the great old school standard, write letters. Have your kids write letters, you write letters, include some art from your children, and mail it. You can mail letters every day. That gives our parents and grandparents something to look forward to every day in the mailbox. And then finally, if your elders are living in a retirement community or in a care facility, call the care facility. Ask them, what is their plan for a COVID outbreak? How are they addressing staffing issues? Do they have enough medical supplies? Ensure that they have your phone number and ask them what would happen if your loved one is exposed to COVID-19 in their facility. For more information about how to work with our elders and make sure that we can reduce their anxiety and their stress, including our own, please refer to the Centers for Disease Control website and just search elderly and COVID-19. Until next time, catch you on the well side.
Thank you, Dr. Kelly, for bringing us that amazing mental health tip. For all of our county residents, we hope you got some value out of it. In the meantime, stay well and take care.